And we're live from our studios here in Kokomlemle on digital address GA0992539. Our lead stories this hour here on The Pulse. A chilling discovery of pediatric COVID-19 cases. A case in isolation. Today we explore a reported surge in COVID infections among little children, including an 11-day-old baby. A shift from earlier known facts that children robustly fight the virus. We are at the Komfo Teaching Hospital to understand this situation. We also focus our attention on health workers as at least 10 of them die from COVID-19 and more than 200 infected continue to fight for their lives. The Ghana Medical Association is asking the country to revisit the measures deployed last year to stem the threats. And also coming up, Supreme Court dismisses another attempt by lawyers for the NDC's John Mahama to ask some 12 questions of the chairperson of the Electoral Commission. The lawyers say it is unfair, but President Akufo-Addo's lawyers say it is an emotional reaction to an unfavorable ruling. We have highlights and updates before the conclusion was made as two more judges join. We'll tell you who and why. And The Pulse is brought to you by Global Communities Dignilu, affordable, safe sanitation. Do join us on DSTV 421 GoTV 144. We're streaming live on YouTube and on our other social media handles. Do send us a WhatsApp on 0540-109009. My name is Gifty Ando Apia. This is The Pulse. As always, please be my guest. You're welcome. Let's take a look at the details. The Komfo Teaching Hospital is recording an upsurge of COVID-19 cases among children. In the last 10 days, the facility has recorded 9 child cases, including an 11-day-old baby. Head of the Child Health Directorate, Professor Samson Enchi, says the situation is taking a toll on the facility as management struggles to access space for children diagnosed with COVID-19 and other cases.
The Komfo Teaching Hospital is the only pediatric referral facility in the northern sector of the country. Like other health facilities, the hospital is overwhelmed by the number of COVID-19 cases involving children. At least 9 cases have been recorded in the last 10 days. Head of the Child Health Directorate, Professor Samson Enchi, says the situation has put a strain on the hospital.
We are having a huge surge in COVID-positive cases. The disease initially, children were said to be spared. We have 14 of last year. But this year, just in a space of 10 days, we got 9 positive cases, children. And our HIU, remember, our main pediatric HIU is 3 bed. That is full. MBU is 1 bed. That is full. And so it's so happening that from 2 other positive, other 2 are well, they've been discharged. 1 person died, have been discharged. And so we had another 2, but we have to keep them at the holding area. The COVID strain that we are having now is really also affecting children, seriously, because in the question of 10 days, less than 2 weeks, we are getting 9 cases. We don't know where we're going to go. And we are already full. And so that is what we are saying, that everybody must help.
Management says the hospital is overstretched and it is in dire need of space. Professor Enchi says the facility can no longer admit pediatric cases. He says there are ongoing talks with the Regional Health Directorate to create a treatment center for children with COVID-19.
As it is now, we are not in the position even to bring new cases. I don't mean COVID. Anybody who is sick will come here. We will just drag you in front, probably in an ambulance that you came with. If there's something we need to do for you, we can do to stabilize you, then we send you back. Because our wards are full, we are exploring the possibility of getting treatment center for children. As far as I'm concerned, we haven't got a place for children. And just Monday, we are in talks with the medical director to actually talk with them. I think he also had discussion with the regional health directory to see if they can create space for children who are stable, COVID positive who are stable, so that we can move some of them there, so that we can get space.
Medical Director of the Komfo Teaching Hospital, Professor Bafo Kofi Poku, says out of 504 samples taken, 251 representing 49.8%, returned positive.
At the end of yesterday, which is the 26th day of January, we have tested 504 patients, out of which 251 are positive, 49.8%. Almost 50% of all patients who have come here and have been tested have been found to be positive. So it is the duty of us, and together with you, the press, to drum home to the public about the need for us to take the preventive measures seriously.
Meanwhile, management has denied allegations of neglect and lapses in its COVID-19 management. Some caregivers at the Child Health Directorate have accused management of putting their lives at risk as suspected COVID-19 cases are managed alongside other patients. But at a press briefing to respond to the allegations, management denied the allegations. From Kumasi, for JoyNews, Ohime Teria reporting.
Ohime's reports there. Meanwhile, the alarming rate of pediatric COVID cases, of course, is taking a toll even on those who work there. Let's go to Ohime Teria, who is joining me via Zoom. Hello, Ohime. Hello, Ohime.
Now the video tool.
We'll be getting through to Ohime Teria to find out from him. We understand that there have been a number of deaths. Let's clarify this with Ohime. How many of those deaths occurred in just this year? Hello, Ohime. Can you hear me?
Yes, Gifty, I can hear you.
Great. So, Ohime, help us understand, clarify the issue concerning the deaths. I think about last year, we know that some 4 of the children died to COVID-19. Help me clarify this.
Yes, Gifty, is the same question that I asked the head of the Child Health Directorate, Professor Samson MP, at the Konfanochi Teaching Hospital yesterday, and he couldn't put a figure to the number of deaths that have been recorded at the facility, but he indeed confirmed there have been some deaths involving children at the Konfanochi Teaching Hospital since last year. And when we started working on this particular story, where health care providers and doctors and nurses accused management of failing to protect them in the management of COVID-19, it came up that one of the 9 children who suffered or who contracted COVID-19 recently has passed away. And when I spoke to the head of Child Health Directorate, he says he wouldn't want to be misquoted, so he wanted to get the figures right. But he indeed said some of the children have died.
So we know for a fact that some of the children have died, and it is from COVID. What we don't know is the number. Ohime, is this correct?
Yes, this is correct. But just this afternoon, my attention was drawn to an interview that Professor Samson Entry had on a local radio station in Kumasi, and he revealed that 3 children have died since last year. So taking into consideration what he told me yesterday and what my investigations revealed, that these 3, one could be from the 9 that have been recorded, and then 2 last year. So that is probably what might have happened, Gifty.
Well, Ohime, you've been speaking to some authorities there. Let's listen to Ohime's conversation with them, and we'll go back to Ohime afterwards.
Pediatric COVID-19 cases as at the end of 2020. But the facility has recorded 9 positive cases in the last 10 days. The child cases were among 504 samples taken at the facility. After testing, 251 tested positive, representing 49.8%. Doctors at CAT are disturbed at the infection rate among children. Head of Child Health Directorate, Professor Samson Entry, says further investigations need to be conducted.
We are having a huge surge in COVID positive cases. The disease initially, children were said to be spared. We have 14 of last year. But this year, just in a space of 10 days, we got 9 positive cases. Children. The COVID strain that we are having now is really also affecting children, seriously, because in the course of 10 days, less than 2 weeks, we are getting 9 cases. We don't know where we are going to go. And we are already full. And so that is what we are saying, that everybody must help.
Professor Entry says, though earlier studies suggest children were spared of COVID-19, the trend has changed.
People are talking about the fact that probably the strain, I don't know whether clinical cases that we are testing belong to the new strain. What I know is that they said that those tested at the airport coming from have shown the new strain. We don't know whether they've actually gotten into the community. It appears to be more virulent. Virulent means that infectious. It means the ability to infect somebody is higher than the previous one. And that is why children, naturally, we think that because children are exposed to a lot of Qatar viruses. Coronavirus is like a Qatar virus, actually. What the science tells us is that there's a cross antibody reaction. Some antibodies to normal coronavirus that children get are able to neutralize the COVID. And that is why children were a bit spared. That is what the science is. Now, we don't know. I think that we need to probably do more research and find out whether this new strain is different. Probably the Qatar antibody that children get that was able to protect them somehow is not able to do the same for this current strain. So we are alarming. I mean, I'm saying that just within 10 days, we got 9. And so really, we don't know where you're going to go.
Meanwhile, the Komfanoche Teaching Hospital says it can no longer admit more patients as its wards are full. Officials have appealed for COVID-19 treatment center for children. From Kumasi, for JoyNews, Ohime Nteria reporting.
So that's an update or an updated version of the report we played to you earlier that Ohime filed. So as it stands now, the authorities at the Komfanoche Teaching Hospital are looking to understand what it looks to them like a different strain or a different variant of the virus that we're dealing with. Mind you, on a national, at the national level, there are discussions that we have identified certain different strains which we're still studying to substantiate. Ohime, let me just engage you briefly before we go on with the next matter, which I'll still engage you on again. The authorities at Komfanoche Hospital seem to be alarmed, and they are talking about it. But do the people themselves who are going there, 50% of whom are testing positive, according to the doctor, aware of the situation, and are they responding correctly to it?
It's a bit difficult to speak to people what they make of the situation at Komfanoche. Responses as to how people are reacting the issues at Komfanoche, but how people react to the management of COVID-19 and how they should adhere strictly to protocols as outlined by the Ministry of Health as far as COVID-19 is concerned. Even at the facility, we are told, according to the medical director, Professor Bafo Kofi Poku, he says there are instances where parents or relatives of patients who come to the facility, especially I'm referring to the Child Health Directorate, they come and when you ask them to put on their face mask, they renege in doing so. And there are also instances where even health professionals and nurses will also, renege in putting on the face mask. And there are also instances where these nurses, though they may be in face mask, will sit down unconcerned as they watch some of these patients' relatives flout these COVID-19 protocols. So to the people outside the hospital, they seem not to care so much about the developments and happenings at Komfanoche, to the extent that some have also chosen to use Komfanoche as a thoroughfare. Those who travel from, say, Bantama to the central business district of Adum prefer to use Komfo as a thoroughfare to avoid, falling into heavy vehicular traffic. But the hospital management have on several occasions warned that because of the precarious situation at Komfo, where people who go to the facility continue to test positive for COVID-19, and the virus is also airborne, they expect that people will be aware of this danger ahead of them and not use the premises of Komfo as a thoroughfare. But still, you still have people who flout these warnings. As of yesterday, the arrangement from hospital authorities after a management meeting was that now they are going to restrict the number of visitors who patronize the facility. So if a patient is on admission at the facility as of now, the only thing they can do is to allow one visitor a day, and that is the arrangement they have introduced, and they say it's because of the upsurge in COVID-19 cases. And so, Gifty, I must say, yes, the situation at Komfo is a bit dire, because when you look through the statistics as provided by the medical director, since last quarter, between last quarter and this year, as at January 26, 504 samples which were taken, 251 returned positive. This represents 49.8%. So it is an indication that indeed COVID-19 is real and very present at the presence of Komfo Teaching Hospital.
Well, Ohime, hang on for me right now. Let's talk about the Ghana Medical Association. Their general secretary says a lot of hospitals are under stress and immediate measures ought to be taken to support the country's health systems before the system crashes.
I mean, this statistics, it takes it that this is a small research, in quotes, and this is at a community level. People within Kumasi, Ashanti region, basically go to Komfo, and a small sample size gives you 50% return in terms of positive results. It tells you that we have significant community spread. I agree that the sample size may not be too huge, but if you look at the trend, it also mirrors what is happening within the national space, where our figures were down, let's say, between September till now. You can see a progressive rise, but in January, the rise is very steep. So clearly, we have a big problem on our hands by way of the COVID infections in the country. The second bit has to do, listening to him, has to do with the difficulties that the health facilities are facing, and the fact that clearly they are overstretched. You can see how, per the report, they are struggling to handle COVID patients, specifically when it comes to kids. You could see the problems in there as he described or gave us a vivid account of what is happening. And then issues relating to infection prevention control, and the fact that hospital-acquired infections may also be going on, all as a result of the fact that we don't have enough facilities to manage COVID. So the problems are there. The society itself also doesn't seem to be listening to a large extent, because it tells you that people come into the health facilities and they don't even have masks on. They are not masked up. Meanwhile, last year at some point, it was so clear that without a mask, you cannot even enter the hospital. You will be turned away. So clearly, we have a challenge on our hand, and we will need to take some very drastic measures now to help keep the situation. Where we are heading, it doesn't look good for us. That is the obvious truth. We need to act and act now, because on a daily basis, the problems keep compounding, the issues are being brought to the fore, and that is it. This is Komfo. It's the second biggest hospital in the country, and you see the problems there. Technically speaking, the biggest hospital, Kolebu, is no different in terms of the problem.
It's scary.
Fast forward it to the regions that don't even have the facilities and the human resource to start with. That creates a huge problem, especially when it comes to the specialized units like the AGUs, the ICUs, where you need specialized professionals in terms of practice to take care of the situation. So the health system clearly is overstretched. And one thing that we all have to understand and we all need to do quickly is that we need to go back to the measures that were put in place at the various health facilities some months back, where the OPDs were technically speaking regulated in terms of numbers, where some chronic patients could not really come in as it is. We were managing them via, e-health, mechanisms, i.e. video conferencing, phone calls, stuff like that, telemedicine, that kind of thing, where community pharmacists were interacting with doctors to help ensure that some of these patients can get their results. That will reduce the numbers coming in.
That's the General Secretary of the Ghana Medical Association you had there. Ohime, are you still there?
Yes, I'm here, Gifty.
All right, Ohime, I just want you to hang on because there are still concerns that the GMA is raising. They're also calling for investigations into growing resentment among caregivers, also at the Komfo Teaching Hospital, over the management of COVID-19 cases there. The caregivers, especially at the Child Health Directorate, say the poor management of COVID-19 positive cases puts their lives and that of other patients at risk. And the Ghana Medical Association also says that the issues raised by the medical staff should be treated should not be treated lightly. Ohime will give us more on it, but take a look first.
Some doctors and nurses at the Child Health Directorate of the Komfo Teaching Hospital have revealed there is no concerted effort by management to either test staff who come into contact with COVID-19 positive cases or close down wards for fumigation. A nurse who spoke on condition of anonymity says the over 400 caregivers are compelled to work without the right protective gear. She insists medical staff who voice out their concerns could become targets and victimized.
We know that COVID-19 should be managed, 1, in an isolation, 2, by trained professionals, and 3, with specific PPEs. And all these 3 things are being lacked. We initially had suspected, and getting results was a problem. Finally, when they became confirmed, we had to manage them on the ward. Because as we are being told, there is currently no trained personnel and no specific place to keep those patients. So they were being managed on the ward. In the first place, we don't even have social distancing on the ward because the wards are full. We had to manage these patients side by side with the average normal sick patients.
The Ghana Medical Association says the issues raised by the caregivers borders on life and death and should not be glossed over. Dr. Pakwesi Bedu is the Ashanti Regional Chairman of the GMA.
Any issue that borders on threats of life is very serious. And we've seen that now with the new strain or the second wave is killing people. And per your report, even kids now, somebody less than 1 year is getting it. So nobody is immune. So any case that threatens the life of any health worker should be looked at and shouldn't be swept out of the condition. And as you rightly said, from here, we'll be talking to management. Luckily, we're also going to find out what really happened.
Dr. Bedu spoke against victimization and encouraged medical personnel, especially doctors and nurses, to voice out their concerns through leadership for redress.
We've been talking about this culture of silence within our hospitals, the various hospitals. And we think if we keep sweeping these issues, when next time something like this arises, nobody will mention it. But then it kills the morale. And you realize that people go to work, they are so scared of what they will come into contact. And when they contract something or they see something, they are scared to. It kills the morale. And by extension, because if the health worker is not happy, we tend to displace that unhappiness onto the patient, which shouldn't happen. But it's a human institution. So you find most of us being rude. Some of these things stem from when concerns are raised and they are not addressed adequately. It brings about these agitations. Victimization is real. Unfortunately, we have turned most of the hospitals into an extension of our political parties. I never heard of party associations within hospitals, but here it's so prevalent. And so if there is something going on and I raise it that maybe, this issue is happening, ABCD, and I think we have to address it, the first response is, you are against us, you'll be tagged.
Management of Komfo Teaching Hospital is yet to respond to the concerns of the workers. From Kumasi, for Joy News, Ohime Interior reporting.
So, Ohime, at the time you filed this report, there hadn't been a response. Has there been any so far?
Yes, management of the Komfo Teaching Hospital has responded to the allegations raised by the workers and dismissed most of the allegations. But listening to the explanation that they give, you could at a point, feel that indeed some of the issues raised by the agitated workers were indeed true. We can take a listen to the head of the Child Health Directorate, Professor Samson NG.
It is not true, as I heard from the news item on Monday. I heard it on JoyNews, that we haven't gotten a standing team that handles COVID cases. That is not true. It cannot be. And of course, if you have a standing team, it means they are trained. And you see, we are doctors, we are nurses, we are health professionals. A case you may see, you think not COVID, will turn out to be COVID, and we are taking care of this. And so the idea was those who were trained at the COVID team to train everybody, every staff. And so everybody has been staffed for you to also suspect. And if it need be, you can also support treatment of cases. So by this, we cannot actually mix children who test positive with those who are not suspected cases. But you should expect that sometimes somebody will come, you screen, he didn't fit into a suspected case, and then he's admitted to the wards or any other place, not in the holding area. In the course of time, he may develop symptoms that you review that would then suspect COVID. What will you do? Definitely, that person will need to be put in the holding area, and then you test, then it's positive. So in a scenario like that, a staff who is handling a particular group of patients in a ward, a child later is suspected after he's passed through the screening to have COVID, and the person tests positive, and that one constitutes missing cases. We cannot do that. We can't put the life of other children at risk. We can't put our own staff life also at risk.
So, Ohime, that's the explanation being given by authorities there. Have you had a reaction on the back of this explanation from those who are being complaining?
For the caregivers, they believe that this particular response from management is indeed confirmation to the earlier concerns that they raised. For instance, Professor NP says there are instances where a patient who report at the facility could go through screening, and later probably he will not show signs or symptoms of COVID-19, but later will show the signs and symptoms. This comes to the allegations that indeed when this person shows symptoms at the wards, he still be lying and mingling with other patients who are not COVID-19 positive. So by the time they get the results and try to move this patient from the ward to a side ward or probably to the demarcated treatment center, then it means this person may have mingled with the negative cases. And then again, the caregivers also mentioned the lack of social distancing at the wards. management also indeed said it would be difficult to manage social distancing at the wards. And they also mentioned the fact that there are instances where they don't get appropriate PPE. The word that they use is appropriate PPE, but management says they've been giving these caregivers a PPE, but the concerns of the caregivers or the doctors and nurses is that they don't have the appropriate PPE. So all these responses, if you sum them up and compare to what these doctors and nurses said, then it means that the management of Komfo Anokye Teaching Hospital has a long way to go in ensuring that they provide ultimate care to both the general public and its staff. So for the doctors and nurses, they say they will continue to do their best, even put their lives on the line to save others. But then they expect management to also come to their aid, give them the appropriate materials, appropriate equipments that they are needed to work with at the facility.
Ohime, thank you very much. This obviously is a developing story, something we'll certainly keep following until there is some level of consensus. Ohime, thank you very much for that update. Ohime Nteria is in our sister station in Kumasi, Love FM. They're bringing us up to speed on the situation at the Komfo Anokye Teaching Hospital. We're still on health. Well, the Ghana Health Service says COVID-19 cases in the Bono region could increase beyond expectations if safety protocols continue to be disregarded. The region has recorded a total of 657 cases, with 2 people being killed. 15 new cases in January alone, 11 active cases with some on oxygen at the hospital, while over 90 samples await results. With 2 laboratories set up almost ready in Sunyani and Brekum to test COVID-19 samples, the Health Directorate says it will take the collective efforts of all stakeholders to contain the virus. Bono Regional Correspondent Precious Semevo has more.
The second wave of the global pandemic, COVID-19, requires that safety protocols are seriously observed again. Though adherence to the protocol seems better than a month ago, many residents were seen disregarding the wearing of the face mask during a visit to the central business district of Sunyani in the Bono region. With a surge in cases, deaths, and patients on oxygen, Dr. John Eko Otu, Deputy Director in charge of Public Health at the Bono Regional Health Directorate, says resident attitude towards the safety protocols is not the best.
We've recorded a total of 657 positive cases. We have 11 active cases that we are managing. Some, unfortunately, are in a treatment center on oxygen right now. Unfortunately, we have recorded 2 deaths, the last one being just last week. We can go a whole month and we may record less than 5 cases. But for this year, from 1st January till now, we've recorded 15 cases, of which 1 has passed on. The only unfortunate bit is that the adherence in the region hasn't been the very best. December was a very busy month. We did the elections. We went to celebrate Christmas. We celebrated the New Year. During all this period, you could see that people were not adhering to safety protocols. We have been continuously educating the people. Every opportunity we get.
He says mass testing is not the best option since the COVID-19 vaccine is not readily available to be administered.
The list of the districts to record a case is the Damar West, where they have recorded only 3 cases. Wenchi municipality is leading with a total of 189 cases. And somebody will ask, why are you not testing everybody? So you can test you right now. You step out, you meet somebody who has got it and you don't take the precautions, you become positive. And you'll be walking about with the notion that you are negative. If we had the vaccine and then we want to know those who are not infected, so we vaccinate them, then in that case, we can test people, then immediately you test negative, we vaccinate you. But we are not doing that.
With the region soon to start running COVID-19 tests from 2 labs in Sunyani and Brekum, Dr. Otu says non-adherence to the protocols will lead to an overwhelming number of cases and appeals for a change in attitude.
Because for a very long time, we have not had a lot of cases most of the isolation and quarantine facilities in the district are not very ready. We've just sent communication to them to ensure that all these facilities are ready because of the way the numbers are going up again. The Sunyani Regional Hospital and the Brekum Holy Family Hospital have got their laboratory set up to be able to test COVID-19 samples. The test run was done over the weekend. So any moment from now, we'll start testing our samples here. And I think that's also a positive sign. If things continue the way they are continuing and people don't adhere to safety protocols, by the close of next month, we will have cases more than what the region had ever recorded. Of the 92 samples we've taken, one is on oxygen right now. So you can imagine. You see, our best bet is to get everybody to adhere to the safety protocols.
For Joy News, Precious Semevo, Sunyani.
Just watching The Pulse with me, Gifty, and up here. We're going to take a very quick break. When we return, we still have a lot more to share as far as COVID-19 is concerned. We'll also take you to the Supreme Court with highlights of what happened earlier today as the court dismissed for a second time another attempt by John Mahama's team to ask 12 questions of the EC chairperson, Jean Mensah. We have more. Do stay with us. You're welcome back. Many thanks for staying with us. Medical doctors are urging COVID-19 survivors who have identified some changes in their bodily functions or any post-COVID symptoms to immediately seek medical support in order to remedy the situation. This follows recent research of the effects on some people who have survived COVID-19. Seizures, mental health issues, infertility, and erectile dysfunctions are some of the findings. Dr. Justice Yangsin, who was speaking on Joy FM Super Morning Show, stated that even though reports are not conclusive, damage caused to the testicular cells by COVID-19 through hyperinflammation of the cell tissues may affect male fertility in the long run. He said this while explaining the effect of the COVID-19 on sexual health of male patients.
Post your recovery, like you described, you're testing negative, you're being discharged from the hospital and what have you. There are residual problems or complications that these patients will have to grapple with, especially those who get moderate, severe critical illness. And then even those with mild conditions who have been treated at home and all that, they also can get these problems post their recovery. And the problems cut across all organs. You may not have all, but you could have a combination. It could be 2-3 different systems or organs involved. It could be just one for you. But the long and short of it is that post-COVID problems are there. Let me just mention a few of the things we see, and then we'll zoom in on why ED or erectile dysfunction in particular. You can have situations where these people will keep having the problems, and sometimes they've been described as the long haulers. For 100 days, for 6 months, they still have problems. So fatigue, things like muscle weakness, difficulty breathing, difficulty sleeping, hair loss, loss of smell, taste, problems with, say, their mobility, issues around, let's say, mental health, depression, anxiety, some neurocognitive, disorders. So somebody, for example, like the sort of things you may see in somebody with, say, dementia, those ones are described as neurocognitive. So maybe loss of memory, stuff like that. They are affected. Some are beginning to get seizures and what have you. It's all because of the problems that COVID has created. And a lot of it is as a result of what we call the hyperinflammation that occurs when COVID-19 is at play. And that results in all these residual issues.
So are there some people who are more susceptible to these post-COVID effects, like maybe older people or people with particular pre-existing conditions, or people in a certain part of the world? Who is most likely to end up with, erectile dysfunction or any of the other post-COVID symptoms?
Well, the truth is that the research is still ongoing, but the figures show that generally, like I said, those who get severe critical illnesses, those with moderate disease, tend to have these things the more. But of course, even those with a milder form, they also get. What we have also seen is that those who have some general, let's say, disease burden, poor health generally, may also come up with these things. But the long and short of it is that all these things we have described, the hyperinflammation and what have you, the blood clotting and all the bits, result in a situation where you have damage to the vessels. The middle organ is such that it is blood that is pumped into it for the erection to be sustained, or for you to see that, yes, it has grown inside. It's a spongy tissue. So as and when it has to erect, blood is pushed in. Now, some of these blood vessels that go in there to supply, and then those within the organ themselves, the organ itself, are destroyed by the COVID disease through the hyperinflammation activities that we are talking about. So the linings are destroyed, some are blocked, some clots may also form. So once you have this damage to the vessels, then you can have this problem.
Can it be fixed? Can such damage be fixed?
Hello?
Sorry, I was just wondering, can such damage be repaired?
Well, you may have to see a urologist for assessment. So probably, if you give me a bit of time, we'll get to that bit in no time. Then the heart itself, that also has to pump the blood. The heart and the heart muscles and all that are also, destroyed by COVID. So you have cardiomyopathies, myocarditis, all kinds of things happening. So the blood that has to be pumped there sometimes also is a problem. So this, for example, that kind of problems with the cardiovascular or vascular system can result in this erectile dysfunction. Issues around mental health. It affects your mental health. When the brain is attacked and all that, you may end up with some emotional distress and all of it, anxiety, depression, all the things you can talk about. Not just the attack on the brain, but even the circumstances around COVID, the isolation, the loss of family, friends, all the bits that happen can lead you into a situation where you could get, say, depression or any of the mental health or psychological illnesses, and then you end up with some emotional distress, some low libido, and ultimately that poor mental health will also result in some poor sexual function. And that will result in a situation like the erectile dysfunction. The overall disease burden, poor health, medications that you are taking, put together could also result in it. Then there's sometimes also damage to the testicular cells, the cells within the testis. That is where testosterone is produced. And generally speaking, that is what makes us men. Testosterone is what makes us men. So when the cells within the testis that are supposed to produce this hormone are also destroyed through the hyperinflammation that COVID brings about, then you have a situation where your testosterone level.
That's Dr. Justice Yankson there. So you just have to be aware and just to steady your body and understand what is happening. You need to report as well. Well, some of you have already been flooding our console with so many messages. Let's see what you're saying. Okay, let me just put this right. Let's see. So this one says we are dying. Says we are dying in this virus seriously. Musa Anani Christian Kofi is sending that from Japan. Well, we're not dying if we do take care of ourselves so that we are not infected. This one says the surge in the cases is a signal that we need to lock down. This is because our facilities are not capable of containing large numbers. You don't add your name, not to any of the messages that you've sent. Please, Okay, you were just sending in a correction. This one says COVID-19 is real, but measures are difficult on the part of hospitals and government, and soon a serious lockdown awaits us. You don't also add your name. This one says, personally, I think the surge in the COVID-19 cases was bound to happen, considering the negligence of most Ghanaians and our leaders who continue to push their political agenda without taking into consideration the number of positive and critical cases. Firdaus Adam from Sotum. Firdaus, thank you for sending your message. But the health experts have said that enough of the blame game. We ought to keep going on observing the protocols. This one says, the students in the Upper West region have not received nose masks yet. Primary school pupils have not. What is the problem? Please, let's find out from the government through your media. Leferi from Magu sent that one. So Ghana Health Service, there is a message from the Upper West region saying that primary school students still do not have the PPEs that they are expecting. This is pretty long. I'll try and read a bit of it. It says, good afternoon. Isolating suspected cases of COVID-19 in the same building, and more specifically the same room or hall with shared washrooms, is one of the contributing factors to the high rocketing spike, too many words put together, of the infections, because at that moment the results may not come in for which others may spread the virus to their colleagues isolated, as many asymptomatic cases. So let me try and understand your message. Your message is that when we isolate people and we put them in the same room or in the same building, so for example, the Konfanochi Teaching Hospital, where they are in the same hospital but using the same washrooms, you are saying that if that happens, that is one of the key things keeping our numbers of infections very high. I'm not quite sure what the situation is because what we know is that the triaging process at the time we were told about it was that it was it was kept, people who come in with any symptoms are kept separately from those who are in the hospital for non-COVID cases. But certainly as we go along, we can get some more explanation on this. You are Bettinos Degra. You didn't tell us where you're sending it from, but you say that it's time we rethink and consider our isolation centers and protocols before it gets out of hand. Let me do the very final one or two. This one says, about the COVID insurance package, the government has not delivered. Imagine being a nurse taking care of COVID patients and ending up with the infection, going on admission for 12 days and finally being discharged with complications from COVID-19, heart complications, myalgia, I hope I got it right, and still nothing from government. Okay. I'm sure that the packages are still being worked on. I don't have the answers. I'm just thinking aloud, but we'll follow up on that one. Well, let's move on with some other COVID-19 stories. We'll come back to your messages. According to the Ghana Health Service, the number of workplace infections are on the rise, even as the daily new cases continue to surge.
Is what is happening in KIA, and what are we doing in brief on to manage the surge? I will say that the number of new infectious cases still remain high, but has stagnated in the last few days. So we still run between the same numbers you have. That's about between 600 and 670 thereabouts. So that's where we still are. So we are not seeing the rapid escalation that we saw earlier from the 300 all the way to 600. Active cases continue to rise as a result of the surge, and we are hoping that if we stabilize the number, the recoveries will increase and the active cases will start coming down. The cases are mainly in Greater Accra, located in Accra Metro and its surroundings. I'll show the heat maps and the spots that we have. And the case still remains. And the travelers still continue to add to the numbers who are coming in, but we have seen a decreasing number of positives coming from the travelers. So, in summary, the total number of active positives we have ever recorded is about 63,883, We have tested about 757,000 plus, with a cumulative positivity of 8.4%, and our current active cases is roughly about 3,940. We have recorded 390 deaths so far, and you can see that there's been a rapid escalation in the last few weeks of the number of deaths. Today we are reporting a new total new cases as at 25th of 2025 cases, and the majority, as we keep saying, are in Accra, not Accra Metropolitan, Ashanti second, followed by Western. Currently, all 16 regions have active cases, but as at this current report, 10 regions did not report any new case. So only 6 regions reported a new case in this reporting period. All of them had no case, which is a good sign. Zooming in on Accra, which is our main spot, the number of contact rates about 330. The total number of contacts listed in this as at 27, that's just January, is about 8,679. Contact listed for just yesterday was 536 new contacts. So far, they followed about 8,043 contacts, and out of them, 283 of these 8,000 contacts have turned positive, giving a positivity rate of 3.5% of those who were contacts.
So slowly we're hitting 4,000. Slowly we're hitting 4,000 active cases. What Dr. Kumabwaje further discloses that the institutional and self-referral activities are hampering government's COVID-19 management program. He's therefore calling for cooperation from infected or affected institutions, even as more positive cases are recorded at the workplace.
To care is hampered by institutional and self-referrals. What do I mean institutional referrals? Especially a workplace outbreak, you'll say that, oh, you are there and HR manager calls you that somebody has turned positive, so go and get tested. That's not contact tracing. When you have that, you report to the health sector around you. They come and do a risk assessment, identify the positive, because the people who work with you, they live in communities, they belong to clubs, they belong to gyms, etc. So the health sector can map all these places and do a proper contact tracing. Also self-referrals. So you go, you get tested, you get your results. It may take a couple of days if the lab doesn't enter quickly, for the health sector to identify and respond to you. So the most appropriate approach you are encouraging people to do is that as soon as you feel unwell, please report to the nearest facility. They will give you a referral, and then you go. So as you are going, they are expecting your results. And so even if it doesn't come, they are following up to see whether, even if it may be a false negative, for example, especially declarative symptoms, etc. So I think let's make sure we do that. But because people have elected to do that, we have also put data entry clerks also at the private sector labs, and we have seen some improving number of data entry, rapid response, and linkage to care. We will continue working for that to ensure that the link, especially for the sick, is done promptly so that we can save lives.
Meanwhile, the Ghana Police Service says it will intensify random stop and search operations, as we said earlier, so that they can enforce the wearing of face masks and other safety protocols. It is also urging district assemblies to explore the passage of bylaws to ensure compliance to the protocols. Superintendent Sheila Bachman speaks for the Ghana Police.
We have been engaging with regulators and operators. Various police departments, regions, directorates, and units engage. So, for instance, let me use the MTTG as an example. Transport operators, transport owners, at the lorry stations, we have been engaging them. And particularly in the municipal and district assemblies, we have started engaging to see how they can activate their bylaws to ensure enforcement of the wearing of masks as their bylaws permit, specifically to the regions, and we hope to see results soon. We have been visiting public places randomly. So when we come to an open bar, for instance, and we notice that you are not ensuring COVID protocols, we lock you up. And for those of you who report from the ground, I'm sure you have a few cases you have already reported. But the next step that we are going to take, we are going to have random stop and search on vehicles across the country. So you could be traveling from Tamale to Accra, or you could be traveling from Ho to Hohoi, or wherever, Kwamai to Kumewu, or you could be traveling from Madina to Adenta. It could be a commercial vehicle, most especially, but it can also be private vehicle. For as long as we see 2 or more people on the vehicle, any police officer in uniform can stop you, look at whether you're wearing your mask properly. If not, you will be brought down. And if the driver is wearing properly, the passengers who are wearing their masks properly will be made to go.
Sheila Abaye Kesibakmande, she is the Director of Public Affairs for the Police Service. For his part, Director General of the Ghana Education Service, Professor Kwesi Opoku-Amankwah, said the Ghana Education Service will be stepping up monitoring of conditions in schools across the country following the reopening last week. The service, prior to the resumption of schools, had adopted reopening and recovery learning guidelines to facilitate teaching and learning in a safe environment. But after 2 weeks and 5 positive cases in schools, Professor Opoku-Amankwah says enforcement of the strategies will help mitigate the impact of the closure of schools on the about 9.2 million affected pre-tertiary students.
Now, the next important assignment for us is to constantly monitor the schools and see how well they are doing. So come next week, as we did in the previous reopening, we're going to have teams from the national, from the regional and the district levels to go around to monitor and pick out the issues as and when they come. And these teams at all levels include Ghana Education Service, Ghana Health Service, our local assemblies, and then our various staff at all the levels to ensure that we are able to do a thorough monitoring and give a good evaluation and resolve the issues as they come up. We also want to draw attention to the fact that the home learning support, the online, the Ghana Learning TV and radio are still working, and we will ask parents to encourage their wards to also go online or watch those programs or listen to them to support their learning whilst they are at home.
And that's the message from the Ghana Education Service as well. Well, let's talk about the health workers, Health Service Workers Union. They are part of the TUC, and they're saying that over 200 of members have contracted COVID-19 and 10 of them have been killed. General Secretary of the Union, Franklin Ansa, said this was due to the lack of PPEs and sidelining of some health workers who are not classified as frontliners. The statement issued by Mr. Ansa, 2 health service workers died from COVID-19 just this week alone. He'll be joining us via Zoom to talk a little bit more about their statement, in which they list a number of things that they expect government to do. Let's just go through the statement that they released earlier today. Well, in that statement, they talk about the Ghana Health Service. They talk about the need for government to send PPEs or to share PPEs with all health workers. They talk about mass testing and vaccination when the vaccines become available here in Ghana. And then they talk about constantly reviewing the measures that we've put in place. As I said, Mr. Ansa will be joining us on Zoom so we can talk a little bit more about the concerns that they're raising and how exactly they envisage that those concerns will be met shortly. Let me take a few of your messages while we wait for Mr. Ansa to join us there. This one says, my name is Osman Dawood. Okay, my name is Osman Dawood. It says attention at Komfo Teaching Hospital is due to internal politics. Those in key positions are serving the interests of their political fathers. Due to this, the staff are gagged and cannot express their inner feelings. It's quite a long message. I have others, so I'll just leave it there. And he says the staff infected with COVID-19 have also not been paid insurance packages. This is certainly something that we're still looking into and investigating. We'll bring more of that subsequently as well. This one says the Ministry of Health and Enterprise. Okay, this is an allegation that I cannot substantiate. I will not go into it at this point. And this one says that the blame game on the surge of COVID-19 cases should be put on the blame should be put on our leaders because they have failed us. How can huge cases just vanish? When we were approaching the election, you can see people chanting and dancing, following them during their campaigns. It will surprise you the words that you will receive from someone when you tell them to put on their face masks. Keep your messages coming. I still have a lot of them. I'll try and read some, but we're waiting for the Ms. Ansah to join us. But here is a statement that they put out today, in which they list a number of things that they expect government of Ghana to do. Their concern, as we told you earlier, is that about 10 of their members have been killed, and more than 200 of them have been infected and still receiving treatment. So that sort of sums up what they have, I think, in the first and the second paragraph. Let's move to the next paragraph and take a look. It's pretty long. This one says, so it talks about the situation, and then it says, in such a gloomy picture, health workers at the various health facilities have become the first agents to suffer from the rage of the pandemic. Health Services Workers Union members and the entire health workforce continue to risk their lives. And he goes on to make the point that currently over 200 members have contracted the virus and 10 of them have died. Let's move on and look at the bullet points that they made about their expectations of government. Okay, so there it is. It says that in view of these, which is the fact that members have been infected and some have died, the union herewith profess the following recommendation. One, there should be adequate, appropriate and timely supply of PPEs to all health workers in all health facilities. In doing this, government must put in place all the occupational safety and health measures and protocols. Also, the government, they say, must ensure all health workers are tested and also consider them first when vaccinations and treatments become available. And this is a point indeed that government has indicated they will do. And then it goes on to say that the government, through its health agencies, should do constant reviews, like I said earlier. Also, they want government to honor promises of paying compensations to health workers. So the issue of compensation there as well in the message that I just read to you, to health workers who get infected or those who die out of COVID-19 in the line of duty. They say that though there is education and constant update from government, the union has observed that the increasing disregard of safety protocols by the public gives credence to the fact that there is a need for intensified public education, especially letting the public know that the variant emerging moves faster and is 70% more transmissible. As a complement to public education, the government must continue enforcing the protocols aggressively. Security agencies should ensure strict enforcement safety protocols without fear or favor. On the issue of reopening of schools, the health workers unions say that they think it will be a better decision if government adopts a consistent random testing to ensure that all asymptomatic children in schools are also identified and treated to reduce the infection in schools. It says there should be constant monitoring to ensure that both teachers and students are adhering to the protocol, something that the Ghana Education Service says it was doing. And then it says that the general public is entreated to adhere to the safety protocols. Well, Ms. Ansa, Franklin Ansa is joining me on phone right now. Ms. Ansa, thank you for your time. Good afternoon. You raised a number of issues which already have been addressed by government, talking about mass testing and mass vaccination. We've seen a statement from the Ghana Health Service that essentially talks about mass testing. Are you aware of these?
Yes. Thank you for calling. The union is aware of the mass testing, but it says everybody who walks in. What about the school children who will not walk in?
Okay.
What we said in our statement was that randomly, government should test the students and the teachers so that it will inform us what is happening in the schools.
Okay.
We also talked about vaccination. Yes, we are aware of what government is doing. All that we are saying is, if the vaccines come in, health workers must be vaccinated first, because we are going to take care of the people. Our health should be taken care of.
I think that over the weekend, the former Deputy Health Minister, Dr. Koboy, indicated that health workers are on the priority list. They are first, I think, among the group of first to be inoculated when the vaccines actually get in.
Yes.
Or was this not communicated at the union level, and that perhaps it was something that was said out there in the media, but it wasn't?
Whatever he said has not been communicated to the union and has not been communicated to the health workers. And so, well, even if he has said it, and we are also requesting, it is just to remind government that whatever he has said, he also stands by his word.
Okay. And so the point you're making is that you think that we should have random testing in the schools so that you, the health workers, will be better informed and you know how to manage the situation with them, correct?
As we speak, all the treatment centers are full, and we don't want the situation that will get out of hand. There are a lot of people who are walking around. They are asymptomatic. They are not showing any signs of the disease, yet they are carrying it around. If random testing is not done, and it happens in a school where nobody gets to know, and the situation gets out of hand in that school, children of about 200, 300, a lot of people being infested, who is going to take care of them? It's still have workers.
Okay.
So it is better we take care of it now than the situation gets out of hand.
I'm personally happy that most of the issues that you raised today, we heard at the press conference, seem to have been addressed. But there is something very serious in your statement about your members, that 10 of them have been killed and 200 of them have been infected. Tell us a little bit about this.
My sister, I'm telling you that it is over 200. If we have gathered information about 200 people contracting the disease, you should know that because of the stigma associated with it, there are some members who contracted the disease and will not want anybody to know. And for that matter, it is that serious. Even this week, as I'm speaking, 2 of our members have died to COVID. And we also don't have the full information of the people who have died, but at least those who have reported to us, more than 10.
So there's a possibility that you actually have a lot more casualties and a lot more infections.
This is members of the health services workers union. We have doctors who have died who are not part of us. We have nurses who have died who are not part of us. So health workers who have died, more than 10.
That's a pretty serious situation. It brings us back to the issue of PPEs. It was one of the biggest things we had to deal with previously. And now that we're dealing with a more, in your statement, according to your statement, a 70%, a more dreadful variant, if we can confirm that, which you say has a 70% rate of infection. I don't know. What are you internally? And I know that government should provide this, but are you providing any support to your members internally to at least deal with the situation as we put pressure on governments to do what it has to do?
Definitely, yes. The union is also trying to help. When the situation started, the union bought some PPEs and sent to our members. We bought some sanitizers, we bought some face masks, and we also got in touch with organizations that made donations to the union, and we gave it to our members. But you know, most of these things are consumable. They give it to you today, the next day it is used up, and it needs to be replenished. Government is doing a lot. Yes, we know government is doing a lot. But trust me, there is still more room for improvement.
Have you been in touch with the sector ministry, and have they told you anything about PPEs?
Yes, we have had meetings with the sector ministry, even up to the presidency level. They still assure us that they're going to step up, but it is still not enough. Like I'm saying, they are doing their best. If you give me face mask as a health worker, I'm supposed to use, whilst I'm at work, I'm supposed to use about 3 face masks in a day, disposable one. And so even if you give me a box which contains 50, how many days am I going to use this and it is used up? But the ministry said, yes, we have supplied enough. Enough up to when? This is where the challenge is.
So more PPEs, more PPEs are needed.
The treatment centers have more PPEs because those places, we know the situation is bad. But the situation is equally bad in the cheap compounds and in the facilities that are not earmarked as treatment centers. That is where people will walk in until they are tested positive. And that is where it is more dangerous. But this is where we have the shortage.
Yeah, it's a very difficult situation. But your colleagues who are 200 of them, more than 200 of them, you say, who are down with the infection, are they responding positively?
Most of them have recovered.
Great, great. Mr. Franklin, if there's anything else you want to add, do that for me in like 30 seconds if you can. Otherwise,
Thank you. All that we want to tell our members is that they should stay focused. They should take care of the sick, but they should also take care of themselves. Because the situation is not getting better anytime soon. Thank you.
Thank you very much. Franklin Ansa there, he's speaking for the Health Services Workers Union. They say that over 200 of their members have contracted COVID-19. 10 of them have died. 2 of them just 2 weeks ago. Now, the African Union says it has received significant support from telecoms giant MTN to help it undertake its COVID-19 project. We'll talk a little bit about that one when we return from this break. Just stay with us. And now let's do African Union. It says that it has received significant support from telecoms giant MTN to help it undertake its planned COVID-19 vaccination soon. The African Center for Disease Control and Prevention, the AU's health arm leading the vaccination, says it plans to cover about 60% of the continent's people when the program gets underway. The AU issued its update for the continent today, where it reviewed South Africa, Tunisia, Nigeria, Zambia, and Malawi are top 5 countries reporting the highest number of new cases on the continent. Fred Smith joins me with more. Hello, Fred.
Hi, Gifty.
Fred, so give us a little bit of a background to this conversation.
Well, the Africa Union's health arm, the Africa CDC, they are responsible for managing the outbreak in Africa. And what they're doing is to try and get about 60% of Africa's population vaccinated so they are protected from COVID-19. Then they see what they do with the remaining 40%. And they've been looking for funds to do this. If you recall, at the weekend, we had President Akufo-Addo leading an African leaders meeting on Zoom to decide how to raise money to undertake the vaccination. Indeed, MTN yesterday presented $25 million to the Africa Union to help in this regard. And the African Union says this donation will help greatly towards achieving that 60% coverage for the vaccination that it plans to do. It won't happen immediately, but at least 2 or 3 months ahead of us, the African Union will begin this vaccination. But they said this in an update they've issued. The African Union has been updating African citizens on how the COVID situation is going. And as of today, the African countries or member states of Africa are reporting 3,494,117 cases. That's around 3.5 million cases, which accounts for about 3.5% of total cases reported around the world. And the world, as we speak, has reached 100 million cases of COVID-19. The deaths, though, are around 2.9 million, roughly 3 million recoveries are regarded, which is about 85% of the total cases reported so far. 87,937 persons who contracted this disease in Africa have died so far, and that presents a case fatality ratio rate of 2.5%, and that's also accounting for 4% of deaths around the world. So the data you gave earlier, the 5 countries accounting for 69% of all cases reported in Africa are South Africa, which is 1.4 million, making up 41% of cases in Africa. Morocco contributes 13% at 468,000 cases, and Tunisia with 6% at 202,000. There's Egypt, which has 5% contribution at 163,000 cases. Ethiopia with 135,000, which is contributing 4% of total cases. Ghana is not at this level yet, but it also gave a list of countries contributing to the highest number of new cases. So South Africa, for instance, they are contributing 75,000 new cases so far in the new cases reported this month. Tunisia with 16,000 cases, Nigeria 11,000 cases at number 3, Zambia with 7,000, and Malawi 6,925. There are 5 countries with the highest daily incidence per million population on the average. That's the number of new cases per million population each day. And you have Seychelles, Tunisia, South Africa, Eswatini, and Cape Verde in that order. And if you check, over the last 4 weeks, from 28th of December to the 24th of January, there has been a 4% average increase in new cases reported in Africa each week, each of the 4 weeks since 28th of December. And on the average and by region, there has been a 9% decrease in eastern region, the eastern part of Africa, 4% decrease in the northern part of Africa. You're talking about Egypt, Morocco, Tunisia, and other countries in that region. And there's been a 16% increase in central part of Africa. That's very worrying. 7% increase in southern region and 21% increase in the western part of Africa, which is where Ghana. Yes, Gifty.
Well, which is where Ghana comes in. I was just going to say that it looks like a lot more figures, which our viewers will have to absorb. But to wrap up, Fred, if you can just help us with a bit of what we know regarding collaboration, because people have said that even if you have the money, there are issues in Europe over hoarding, for example, of the vaccine. So even if you have the money, to what extent are you sure of getting the vaccines? Has that been part of the conversation so far?
Well, it's the reason why the Africa CDC is partnering, is looking for funds, actually. The president joined other presidents around the continent to decide on how to raise funds to pursue this so that we are not totally dependent on other persons who may decide whether to send in the vaccine or not, or your ability to acquire the vaccine depending on whether you have money or not. And so it is for this reason that the business community has started responding, and with the MTN giving them $25 million
right.
to support this. And the expectation is that other businesses operating on the continent and are doing well will come in to support, so everybody who needs to be vaccinated receive the vaccination.
Right, thank you. Thank you very much. I think that with time we can also have more of such conversations, especially about what Africa itself can do together to get its own vaccine, perhaps. Well, let's go to Europe, where several thousands are dead. There is a growing concern there also about the new coronavirus mutations, especially after a new variant was found in Bavaria again. An entire hospital was put under quarantine in Berlin after around 20 cases of the B117 variant, which apparently originated from the UK, was found. Here in Ghana, government says inoculations should start by June. Well, there's also growing controversy over vaccine distribution issues, like I was pointing out to Fred. Joining me from Berlin with more is Thomas Sparrow, a correspondent with our partners DW. Thomas, how is the coronavirus situation generally in that part of Europe, and how concerned are authorities about the new variants?
Essentially, there's a divided picture here in Germany. That's how the German Chancellor described the situation here. On the one hand, there is a positive trend when it comes, for example, to the number of cases decreasing, the 7-day incidence also going down. But on the other hand, the number of deaths is still shockingly high, around 1,000 new deaths every day. And there is indeed growing concern over new COVID-19 variants or mutations. One hospital here in Berlin, for example, was forced to halt admissions after several cases of the more infectious variant that was originally found in the UK. Emergency cases were taken to the hospitals and staff were put under a so-called shuttle quarantine, which essentially means that they are only allowed to travel between their homes and the hospital. All this comes, by the way, as Germany marks 1 year since the first person in Germany tested positive for the coronavirus.
So what measures are being taken to deal with these new variants? Here in Ghana, we're dealing with our own, but tell us what's happening on your side.
Well, one clear decision, influenced at least in part by these new variants, was to extend Germany's current lockdown until mid-February, and as well to reinforce mask-wearing instructions. So people here now have to wear medical masks in public transport, in shops and in offices. So in other words, they can no longer use their normal cloth masks. A second decision was to focus more on gene sequencing. That means essentially that health labs will have to sequence part of their samples and check for new variants. And then there has been a big discussion about what to do with air travel, what to do with cross-border movements, with reports saying that the German government has been considering drastically reducing air travel and closing borders to regions where new mutations are prevalent.
And this comes at a time when vaccine distribution has become particularly difficult. What are the problems?
Essentially, the distribution of coronavirus vaccines was supposed to be seen as a big reason for hope, and it still is to a large extent, but at the same time it's becoming a very big headache for European officials. The vaccine, and this is important to actually stress, was acquired by the EU for the 27 member states. In other words, not by each state individually. But there have been organizational problems, and the EU is well behind other parts of the world in its rate of inoculating people against the virus. And there have been issues with some of the producers. Pfizer, for instance, had to cut its production, and AstraZeneca announced it would be delivering fewer doses than agreed with the EU. This prompted officials to demand transparency. And EU Commission President von der Leyen, for instance, said that Europe had invested billions to develop the world's first COVID vaccines and said that the companies had to honor their obligations. All in all, a big debate, and one that will probably continue for some time here in Europe.
Well, there you have it, the scramble over vaccine there, even in that part of Europe, hopefully. we'll have a better situation here. Thomas Sparrow is political correspondent with our partners DW, joining us all the way from Berlin. But here in Ghana, here is a statement that I referred to earlier in one of my interviews earlier. It is coming from the Ghana Health Service. At least that's the signature we get to it. It says that free COVID-19 testing for all walk-in requests such as ill health, contact tracing and exposure. The Ministry of Health has decided that public COVID-19 testing laboratories providing walk-in services can charge only travelers for testing. All other walk-in requests such as ill health, contact tracing and exposure must be done free of charge using public health resources. All public health laboratories are to take note and comply. And so let's listen to the Director General of the Ghana Health Service on this.
We have improved access to testing by expanding, creating additional labs. The Ghana East lab will start by Monday. They will start doing labs there. But we are also saying that, as the Minister said, it is free at the public sector. What we are looking for is this. As soon as you go and you are referred from a health center to or any health facility to their lab, it is free for you at the public sector, free, and that's what. So, apart from those who are traveling, we tested, and that's why we are encouraging that whatever it is, even if it's a cheap compound, they will give you a referral to go and test. And then you can have link. Because it's not just about knowing your status. The most important thing is, if I'm positive, what should I be worried about? What should I do? And that's more important than being positive, especially when we have asymptomatic people still around.
Dr. Patrick Abwaje there. Now, the Supreme Court has dismissed an application filed by John Dramani Mahama asking it to review a decision to disallow him from asking the Electoral Commission some 12 questions. This was after two additional justices, Justice Imoro Tanku and Justice Henrietta Mensah Bonsu, were added to the initial 7-member panel hearing the election petition. Lead counsel for the petitioner, Chachu Chikata, had argued that the interrogatories are relevant, as it would help the Apex Court determine the authenticity of the result that was declared on December 9, 2020 by the Electoral Commission. Again, he explained that Order 22 and the CI 47 can still be applied, since it will not affect the 42-day timeline that the court wants to meet under the CI 99. But given its ruling, the court held that the threshold required to enable it to review the decision has not been met. Chief Justice Kwesieni Yeboah explained that no exceptional circumstances have been demonstrated to necessitate the review powers of the court. Neither has any new evidence been added to urge the court to take a different view. This dismissal follows a similar ruling on another application by the petitioner, Mr. Mahama, to replace paragraph 28 of the original statement of case, as well as file a supplement to their statement of case requesting for the review. Well, the sitting continues tomorrow. Mr. Mahama's side, or the lawyers for Mr. Mahama, has indicated that the ruling is unfair to Mr. Mahama, but President Akufo-Addo's side has said they are just reacting emotionally to an unfavorable ruling. We'll bring you more, by the way, of the Supreme Court hearing in a subsequent bulletin at 7 with Israel Lai. There is more news at myjoyonline.com. If you do log on, and I'll urge you to do so. Share the link with your friend. Invite them to read as well. My name is Gifty Ando Apia. I'll do this again, God willing, tomorrow. Do stay with us.